How does rituximab work for multiple sclerosis? Have you ever wondered how certain medications can help manage complex diseases like multiple sclerosis? Multiple sclerosis, often shortened to MS, is a chronic condition where the immune system mistakenly attacks the protective covering of nerve fibers in the brain and spinal cord. This misdirected attack can lead to communication issues between the brain and the rest of the body, resulting in symptoms like fatigue, difficulty walking, numbness, and vision problems. Rituximab is a medication that was initially developed to treat specific types of cancer and autoimmune diseases. It falls under the category of monoclonal antibodies, which are lab-made proteins designed to target specific cells in the immune system. In the case of MS, rituximab specifically targets a type of white blood cell known as B cells. These B cells play a crucial role in the immune system's harmful attack on the nervous system. So, how exactly does rituximab work in managing MS? When rituximab is administered, it binds to a protein called CD20 found on the surface of B cells. By attaching to CD20, rituximab effectively marks these B cells for destruction by the body's immune defenses. This process helps to reduce the number of B cells circulating in the bloodstream and present in the central nervous system. Since B cells are involved in the abnormal immune response that damages nerve fibers in MS, decreasing their numbers can help slow down or even reduce disease activity. In practical terms, rituximab is given through an intravenous infusion, usually every 6 months, although the schedule can vary based on individual needs. While rituximab is not a cure for MS, it has been shown to help reduce the frequency of relapses and slow the progression of disability in some individuals, particularly those with relapsing remitting MS. It is important to note that rituximab is not officially approved by regulatory agencies like the Food and Drug Administration or the European Medicines Agency, specifically for MS treatment. However, it is sometimes used off-label in clinical practice, especially in situations where other approved MS treatments are not available or suitable for certain patients. The use of rituximab in MS is supported by evidence from clinical studies and real-world experiences, indicating that it can be effective in reducing disease activity for some individuals. Like any medication, rituximab has potential risks and side effects. Common side effects can include reactions at the infusion site and an increased risk of infections due to a weakened immune system. Rarely, it can lead to more serious complications, such as progressive multifocal leukoencephalopathy, a rare brain infection. Because of these potential risks, rituximab is typically prescribed and monitored by healthcare professionals who specialize in managing MS and immune therapies. The decision to use rituximab for MS should always be made on a case-by-case basis, taking into account the specific type of MS, previous treatments, overall health, and potential risks. It is essential for individuals with MS to discuss all treatment options with their healthcare provider to determine the best approach for their unique situation. In summary, rituximab works for multiple sclerosis by targeting and reducing B cells, which are involved in the immune attack on the nervous system. While it is not officially approved for MS, it is sometimes used off-label and can help some patients reduce disease activity. Always consult with a healthcare professional when considering treatment options.